Well, again, good evening, everyone, and welcome to our webinar, Nursing here at Gonzaga, our admission timeline and benefits of the program. Thank you again for joining us from all around the United States and around the world. Again, to introduce myself, I am Levi Garcia, and I am an admission counselor here at Gonzaga. I primarily work with students from Central and Western Washington State, as well as New Mexico. I'll be your host for tonight's webinar. You may have also noticed, too, that you aren't able to turn on your cameras or audio. And this is just so we can record this webinar for our guests who want to view this at a later time. We would love to answer the questions, though. So throughout the presentation, please feel free to use the Q&A box to drop in your questions, and my colleagues will be answering them for you. We will get through as many questions as we are able to. We'll also use the chat periodically to respond to any questions that my colleagues have, and also as well to share any web pages that you might find helpful as well. Now, like I said, I do have several of my colleagues with me that I would love for you to meet. And we'll start with Will, who is co-hosting our webinar with me tonight. Will, do you want to introduce yourself?
Hi, everyone. My name is Will Shoup. I'm going to be kind of looking back and forth between the Q&A over here and my notes and the camera. So apologies if I seem like I'm staring off to the side. That's why. I'm an admission counselor here at Gonzaga. I mostly work with students from Idaho, Montana, and Alaska. And I'm excited to be here, and I'm happy to help you throughout the process.
Thank you, Will. Our colleague Sandra is also here too. Sandra, would you like to introduce yourself?
Yeah, hi everyone. My name is Sandra Vance. I'm an assistant director of admission here at Gonzaga. I'm also our campus visit coordinator, so I oversee all of our on-campus visits and events and many of our virtual programs as well. And I will also be in the Q&A, answering questions, putting links in the chat, as well as touching on a few other things throughout the program.
Awesome. Thank you, Sandra. And our colleagues from the nursing department are also here too. Alex, would you like to introduce yourself?
Hello, everyone. My name is Alex Giffen. I am the undergraduate academic advisor here in the nursing department, and I look forward to telling you all a little bit more about our program.
Can you guys hear me? Okay, sorry, we're still figuring out the camera situation, but I'm Ellie Smith. I am currently a senior nursing student at Gonzaga, just here to answer any questions you guys have.
Awesome. Thank you, Alex, and thank you, Ellie. I'm going to share my screen here so that way you can see our presentation. All right, quick check just so everyone can see the presentation.
Yep, we got you, Levi.
Perfect. All righty. Again, everyone, welcome to tonight's webinar. We know that certainly the college application process can be very stressful. So it's our hope tonight to relieve some of that stress. Many times things are most stressful when processes are unknown or if you have no control over them. So hopefully tonight we'll give you some insight into the nursing admission process, as well as getting to hear from our nursing department about some of the benefits and resources available to students. So to start off with, at Gonzaga, we use the common application for both domestic and international first-year students. This is an application that is accepted by many universities, so it decreases the number of forms that you have to fill out for each school. The cost of a common application is $60. For those of you who are in need of an application waiver, there are a few options. In the common application, there is a box where you can request a fee waiver for economic reasons, and your high school counselor will confirm it. Additionally, Gonzaga alumni can submit waivers on behalf of students through the alumni page of the GU website. It's under the benefits tab. We never want the inability to pay the application fee to be a barrier for applying to admission at Gonzaga. So if you do have questions, please contact the Office of Admission if you ever need assistance at all. To start off with, we have our holistic review for our admission application. It is broken down into several factors here, and the first of the 5 factors in our holistic review process is grades and grade trends. When we look at a student's GPA, we consider their grade trends, whether that's grades going up, down, or staying the same, and circumstances that have led to that trend, including challenges associated with the pandemic. The middle 50% of all the students enrolled at Gonzaga were between a 3.47 to a 3.91 on an unweighted GPA scale. That means that 25% of students were below a 3.47, and 25% of students were above or had a GPA of 3.91. We use unweighted GPA so that all of our students are the same on that 4.0 scale, while at the same time looking at curriculum separately and giving it considerable weight as well too. All of our students applying to Gonzaga should have a standard college prep curriculum, and we'll go into a little bit more detail on that. By college prep curriculum, we mean that students should have at least 4 years of English, 3 to 4 years of math, 3 years of a social science, 2 to 3 years of the same foreign language, and 3 to 4 years of science. For nursing students, we strongly encourage that all applicants to take math and science in all 4 years of high school. We also know that more challenging classes can make for students who are better prepared for college. So we encourage you to take challenging courses if they are available to you, and still allowing for balance in your life. In addition, to help better prepare students for college and therefore factoring into the application and merit-based scholarship that students can receive, many times students can also bring in credits if they meet certain test requirements or college classes. Additionally, these are also kind of the equivalent ones that are offered to here at Gonzaga. We will add a link to in the chat box showing that our AP, IB, Cambridge, and Running Start, as well as college and high school policies and equivalencies. Please note that if you do have college credits coming into that you took while in high school, whether that's through the IB, EB, or Cambridge test that you took, you are still considered as a first-year student with credits, not a transfer student. You may have enough credits to be considered junior standing in college, but you do need to follow all the deadlines for first-year students. So that is November 15th for nursing admission. You're also eligible for first-year scholarships for all 4 years, not the transfer ones, and it's really kind of the best of both worlds. As part of our holistic review process, we also kind of consider your commitment to outside school activities. We're looking for more in-depth in an area rather than what you've done, everything that's been offered. Gonzaga is a very community kind of based experience. So we try to encourage students, get involved on campus and in the community as well too. So while we seek students being involved, starting in clubs, serving as leaders in some capacity, and even engaging in the communities, please note that while working, volunteering, and family responsibilities are important to list in the application, and they do show responsibility, dependability, and engagement in the community, we don't necessarily value one type of activity over another, such as sports over music or music over DECA. We are interested in all of those talents, passions, and abilities you bring to your college community. More importantly, too, is that the college application, or the common application, I should say, requires an essay. And there's a short answer question on our Gonzaga questions page, and another one that will appear if you mark yourself as a nursing major.
For the essay portion of the common application, it has you pick from one of 7 different prompts. And the last one is make up your own question. So you really have limitless options as far as what you want to write about. We encourage you to pick one that speaks to you and is one you can write about well. I also encourage you to make your topic narrow rather than broad, focus in on something. We want to see that you can write well, and we also want to learn more about you from your essay. The best essays let us experience what you experienced as we read them. They show us the experience, they don't tell it. Strong essays also use vivid imagery and sometimes dialogue. They reflect on what the experience meant to them and tie the end of the essay back to the beginning, referring again to something that opened the essay so that the reader knows it is coming to a conclusion. Strong essays are also well proofed for errors, and I'm sure this goes without saying to this group, but they use proper capitalization, punctuation, grammar, even in the short answer sections. I can't tell you the number of times that we've seen little i's or parents' names in all lowercase. Just make sure you're following those basic rules in the whole application. While we're not going to throw out a student's application, it just doesn't leave the impression that you want to leave. And overall professionalism on the application is important and looks good. For the nursing supplemental question, we ask that you write about why you are choosing to be a nurse. We leave it up to the students to write their own stories and be creative and authentic.
Again, Gonzaga is a community that really cares about one another. So the final piece that we look at in the application is your character. And these are seen specifically through letters of recommendation from an academic substitute teacher. Usually these are individuals who you have had a class with, please, and not exactly coach, for example. And also to your secondary school report, which is going to be filled out by your house counselor or the school office. A letter of recommendation is not required from your high school counselor, even though if you do send one, we will add it to your file. With the exception of our homeschool students, Gonzaga is test optional for admission for all majors. That is including our nursing program. All scholarships and all special programs, such as the honors program, are also included as well too. In other words, students applying without a test will have the same access to everything that is students applying with a test score do have. When a student applies without a test score, we try to place a little bit more emphasis on the evaluations of grades, curriculum, and the writing throughout their application. If you do have a test score already and you are wondering whether or not to submit it, here are the middle 50% for test scores in our incoming class. This was for all of our students. It was about a 1250 to a 1410 for the SAT and a 28 to 32 for the ACT. You're welcome to discuss your specific situation with your admission counselor. Then in general, if you have a strong curriculum and GPA, you would have to have a very high test score at the top or above the middle 50%, in order to have that test score make a difference in your application. Homeschooled students who have more than 30 semester or 45 quarter credits of transferable credit that's coming from a college or community college at the time of the application do not need to submit a test score. Those who do have less credit coming in are required to do so. On the Gonzaga questions page of the Common Application, you will also be asked to mark whether or not you want to have an SAT or ACT test count as part of your application. If you mark no, then we will not use your score, even if you have sent it to us previously. If you mark yes, we will use your score, and we would keep trying to contact you to get your test score in if it is missing from your application by the time you apply. If you have taken the same test more than once, we will superscore your total score by taking the best score from each subsection, such as math and evidence-based reading and writing on the SAT, and kind of adding them together. So you are using your scores, but it's always helpful to provide us with all of the information and all of your scores so we can use the highest one from each subsection. Please be in communication with your admission counselor if you do decide to change your mind on using a score or not. And if we haven't finished our evaluation process as well too, then we will make the change for you. Again, the deadline to submit a test score is November 1st for our early action students. International students, you still do have to submit a test in order to showcase English proficiency. We will put a link in the chat box where you can look through the options and requirements for showing English proficiency, such as an online Duolingo test. If you use a test score to meet the English requirement, you will still have the option to be test optional for admission. Finally, there's also a section on the Common Application that allows you to address any hardships and issues that you've had as a result of COVID, natural disasters, and there's a section where you can address dips in your grades or other academic or personal challenges and recoveries. We do encourage you to use these sections if they do apply to you, so you can give us more context regarding your personal situation, environment, and academic history.
So the nursing program at Gonzaga is direct entry. For intended nursing majors, you need to mark nursing as your first interest on the application itself. The program is fairly small and is our most competitive major. The first thing we look for is 4 years of math and science in your high school curriculum. Please note that this is different from our general admission requirements where we encourage 3 to 4 years of math and science. We prefer biology, chemistry, and other life science labs and courses such as anatomy and physiology, but other sciences are great too. It is helpful to have some experience shadowing or volunteering in health settings, but we recognize that currently this is not possible in all areas. Students may students may only enter the nursing program as a first-year student. Since this is a cohort model program with the students taking their classes and clinicals together, it's not possible to transfer into the program. So it's important to note that nursing applicants must apply to GU by the early action November 15th deadline. Applications submitted after November 15th will be applying for a spot on our nursing wait list.
All right, folks, some technical difficulties over here. You are so welcome to contact the admission counselor for your region to learn more and to answer your questions. In a moment, we'll drop a link in the chat where you can find the admission counselor that works with your specific area or your specific school. And if you do interview with us, we'll cover all of your questions, individualized information on majors of interest, as well as scholarships and financial aid and more. Any questions that you might have about the process, we would be happy to talk through in an admission interview. We also do offer some specialized visit days called Nursing Fridays. We do have a couple more coming up this fall on October 25th and November 1st. These days are fairly small, so the October 25th event is currently at waitlist registration and November 1 is pretty close to being full. But just know that our preview days also cover all of the same nursing programming as well as a lot of other events that are offered throughout that day. And we do have a preview day coming up on November 11th. And we will also have all of these same events offered in the spring, and all of our visit registration post January 1 will go live by November 1st. So if you're looking to come visit campus, keep an eye out for more information there. With that, we will go ahead and pass it over to Alex and Ellie. And I apologize, we aren't going to be able to have Ellie's camera come on, but she is there and she will be able to share her experience as a student. But I'll go ahead and turn it over to you, Alex.
Okay, let me put up my fancy PowerPoint this time. Let's see. Can you see it? Oh, almost. Looks like it's blocking out. Is that blocking out for everybody? Levi?
Yeah, I think we're seeing your presenter view, which is why then
Yeah.
the Zoom was in front of it.
Okay. Let's try one more. Nope, it's doing it again. Everyone. Let's see. I'll try one more try. Better?
Better, yes. We just see a little bit of a box up at the
No,
top, but
I
that
missed that.
usually minimizes.
Okay,
Now we're good.
now we're good. Okay, thank you. Hi, everyone. So I'm just going to go over some general things about the nursing program. Since this isn't my in-person presentation, I'm going to skip a couple of the slides, but first and foremost, I'm going to go over who I am and who we have as our team. So just a quick introduction of my team. I am one of many. I am the undergraduate academic advisor, like I said before. I work with Dr. Chris Sloan, who is the director of undergraduate nursing programming, and the BSN program director, Dr. Christy Gonder. We also have a resource and simulation director, Susan Edwards, a program coordinator, Kenley Guss, and then we have a clinical placement manager, who is Brittany Sleggers, a simulations operations specialist who runs all of our high fidelity and mid fidelity mannequins in our simulation and skills suites. And I also have Amber Pangborn as a clinical compliance specialist. I just wanted you to see this slide to see that we have a very large team of support for our students. These people are all in charge of making sure that our students are prepared and ready to go into the hospital setting and prepared and ready to go into courses in lower division. And that is a picture of us at our retreat this August. So when our students leave our program, they are required to take a certification exam called the NCLEX. That exam is administered the same throughout the entire country. You take it in the state in which you are going to practice. This table up here on the top shows the Gonzaga average and the national average from 2020 until current. As you can see, our recent pass rate for the NCLEX was a 98%. We had one student out of our entire class, unfortunately, not pass the NCLEX on first time attempt. That is out of 70 students, I believe, that we had take the NCLEX last year between the fall and spring. This is usually how we do. We do very well on our NCLEX pass rates, and we have always done very well. The only dip you can see here, it goes the same as the national average of 90% for 2020 to 2021 while we were all going through the COVID phase. A couple other stats for fall of 2024, we admitted 103 freshmen this fall to our program, and we have currently 373 students enrolled from freshman to senior. This slide here is a slide of the GU core curriculum. So this outlines what all GU students are going to need to take while here at Gonzaga. They will be required to take all of these courses along with the nursing prerequisite coursework. So you can see in their first year, they'll be required to take a communications, reasoning, writing, and a first year seminar. That's called the freshman core. They're also required to take a math course and a science inquiry course. The nursing prerequisites overlap with their math and science inquiry course. So a stats course will be required that overlaps with the nursing or the GU core. And your science inquiry course typically gets taken care of by either biology or chemistry. In your second year, you'll be required to take Philosophy 201 and a Christian Catholic Traditions course. In your third year, you'll be taking Philosophy 301 or Ethics and a World Comparative Religions course. And then in your final year, a core integrated seminar. You can see on the right side of the screen that you will also be required to take a history, lit, and fine arts for broadening courses, and a social and behavioral sciences, which usually gets taken care of by your psychology or sociology nursing prerequisite requirement. You will also have course designations that you need to complete while here at GU. Keep in mind that because our program is so rigorous that our classes overlap with the GU coursework and usually takes care of all of those course designations. The nursing prerequisites are going to look pretty similar to all of the other nursing programs that you might be looking at right now. So you're going to be required to take a biology in a lab, chemistry in a lab, a psychology course, Psych 101, sociology 101, statistics, anatomy and physiology 1 with a lab, anatomy and physiology 2 with a lab, microbiology with a lab, and nutrition. You will also be required in your freshman and sophomore year to take 3 nursing courses that are taught by our nursing faculty. The courses on the left side of the screen are taught by all of campus. So you're going to be with the biology department for biology, chemistry for chemistry, etc. Whereas the classes on the right side of the screen are taught by nursing faculty. So in your freshman year, fall of your freshman year, you will take Nursing 100, which is called Intro to Nursing Perspectives. You'll also, in your sophomore year, be required to take a growth and development course with our nursing faculty and a social determinants of health course with our nursing faculty. There's a lot of courses that students are required to take in their freshman and sophomore year. As a side note for anybody who has questions about minor coursework, minors for our nursing students need to be completed as a freshman or sophomore in our program. So that means on top of the slide that you saw on the last slide and the slide that you're seeing currently, students will have to add nursing coursework and minor coursework and Gonzaga core coursework to be completed in their first 2 years. There are 3 core courses: World Comparative, Ethics, and your core integrated seminar that you can take as a junior and a senior. We've worked with those departments to ensure that you do not run into any clinical rotation mishaps in your junior or senior year. So it's offered 1 time a week so that you don't overlap with clinical rotations. However, that is not true for the rest of the courses that I just talked about. So history, lit, art, those courses need to be taken as a freshman or a sophomore in order to not run into any of the issues with upper division rotations. Minor coursework is the same way. Honors can be done. I'm not saying you cannot take an honors or ROTC or minors or be a student athlete. We have all of those students here in the nursing program. It just requires a lot of work, and it also requires a lot of communication between your minor coursework faculty and your nursing faculty. I have quite a few students that add on a minor as a freshman because they are all very high functioning and get a little bit bored taking communications and philosophy and writing, and they add on a minor. And then once they get into their junior year, they have about 2 classes left in their curriculum and end up dropping their coursework. So I work very closely with my students to ensure that they are mapping out their curriculum. In fact, I'll talk a little bit in a couple of slides how that works. But your first semester with me, I typically will map out your perfect curriculum with minors, ROTC, or honors so that you can see how many credits per course you are going to need to take. It usually maxes you out at the 18 and may even require that you go up to more like 21, 22 credits, which depending on the minor or honors, you may have to pay an overage. General degree requirements for a BSN. We are currently at 130 credits for our degree. It is split. Our classes are either 8 or 9 semesters. I'll explain that on the next slide. It is a 3.0 requirement for your GPA cumulative to enter your upper division coursework. So once you are done with your freshman and sophomore year, you must be at a 3.0 to enter into your clinical rotations of upper division, and then a 2.0 to graduate from Gonzaga with a BSN at the end of your time. That being said, the prerequisite coursework that I just talked about on the last slide that has biology, chemistry, anatomy, and physiology, if it is a nursing prerequisite course, you must pass that class with a C or higher. A C- or lower is a failure in the nursing program, and you are required to repeat that course. This is done for many different reasons. I can go into grander detail about this, but our program is rigorous. You must pass your NCLEX to become a nurse, and statistics show that this pass rate is going to make you most successful in upper division coursework when you are approaching pathophysiology, pharmacology, and going out into the hospitals and learning how to administer medication. This 8 or 9, sorry, I'm going to start over with that. 8 or 9 semesters. I know most of you have seen this on our website. It is posted many places. We are Spokane. We are rather small. We also have a lot of other nursing schools within the area, and we have to go through a consortium called Clinical Placements Northwest that allocates us a certain amount of clinical spots per semester. That being said, because of that number you saw a couple slides ago, we have 103 freshmen. We don't have 103 spots every semester for clinical rotations. So the way that we deal with this is we split our students in half based on their first semester of performance. I want to start off by telling you that all of our students start with a 0 GPA with us, and based off of their first semester science GPA, which can be biology, chemistry, psychology, statistics, any of these courses in your first semester, we will have your GPA ranked and you will get placed in fall or spring start based off of your preference first. So once you meet with me in the fall, we will make your perfect plan. We will talk over if you have a minor in mind, if you have honors, whatever it is that you need to complete, and we will see how you will be most beneficial in the program for yourself and go over what you should do. If you should be fall start or spring start for your upper division coursework. Now, I've gone across the campus and talked to a lot of the different departments to ask them about minors and if they think that students can complete this in 8 semesters if they take a minor on with our coursework. I have one minor across the entire campus who has told me that students may be able to complete their minor in 8 semesters. The rest of them have told me that they will need 9. So that being said, students that come to me and want a minor are often picking a spring start for upper division so they can complete minor coursework over 9 semesters rather than, well, it's really 5 semesters rather than just the 4 semesters of lower division. They also choose to do a spring start for upper division so they can study abroad for an entire semester, which in the nursing program, fall of your junior year is the only semester that you can do an entire semester of study abroad during a nursing BSN. That being said, study abroad is also offered all summers, and you can take it over the summer since we do not have nursing courses offered over the summer that would interfere. You also can take a leave of absence and work. So we have a lot of students that decide to take a break before they enter upper division coursework. It is a lot of work to do your lower division coursework, taking anatomy and physiology, nutrition, microbiology. It is about 17 credits a semester through your lower division. So I have a lot of students decide to take a leave of absence and just take a break before they put those scrubs on and go out into the hospitals. So when my students meet with me, they'll give me their preference. They'll say they want to be fall start or spring start. We'll put that in a list. At the end of the semester, my colleague Kenley Gus and I will rank all the students by their science GPA. And usually students that request a spring start for their upper division, so spring of their junior year, will get it because we only have about 1/3 of the students that ask for spring start. And then we have about 2/3 that ask for fall. That being said, that means we have about 20 students this fall that will not get what they ask for, and we have to make some adjustments. I am going to just put this little piece in there that we use overall GPA as a tiebreaker. I say that because typically the difference between my highest GPA student and my lowest GPA student is about 0.3. So it's about a 4.0 at the top and a 3.7 at the bottom. So all very, very high standards. All the students do very well. We just have to have a way to split the class in half. And this is how we do it. Our students are informed in January of their freshman year. So they have about 18 months or about a year. Yeah, about 18 months to plan out what they're going to do with the fall semester of their junior year. This is just a slide on study abroad. As you can see, there are many, many, many places that our students can go. I have about a dozen students in Florence right now. I have 4 students in Madrid. I have a student in Auckland. I have a student at Oxford. And I had a handful of students go to Zambia over the summer. And a handful of students go to Glasgow, Scotland to actually take a nursing course from one of our graduate nursing faculty over the summer. So study abroad is very robust. If you haven't looked into it, there is a great website on this and they have everything delineated on there. We also have an office here on campus if you would like to look into any of these pieces. A lot of students will come into the program with the mindset that they want to be trained as a specialist in a certain area. You are devoted to peds, you're devoted to oncology, what have you. All programs of BSN are typically going to be geared to making you a nurse generalist. That being said, what is a nurse generalist? It is a nurse that has these key elements honed in on: basic safety, sound clinical judgment, professionalism, ethical care, and making certain that you are well-rounded. We want you to be positioned to be trained on whichever specialty you choose. And that's why in the next couple of slides, I will show you all of the clinical rotations that we have you do in upper division. We want you to have experience in each of these areas. We want to ensure that you are ready to make the decision of what you want to do when you become a nurse and leave our program. When we say well-rounded, we mean well-rounded. So we have wellness in mind. We have started community events within our BSN program. We have community events. We work really hard on making sure that our students have fun while they are learning our rigorous curriculum. So last spring, we had a scavenger hunt across campus where our students had to take pictures with different areas on campus to show us that they know where the resources are, and that they got to have fun with each other. Each group was made up of a freshman, sophomore, junior, and senior so that we could have everyone together. And because you guys cannot see Ellie's wonderful face, she is actually up in the right-hand corner with one of our high fidelity mannequins that has seizures, blinks, has capillary pulse response, It does everything that you would want to see on a baby in person before you see a baby in the hospital. And then on the bottom right corner, another one of my work study students who is there for our retreat this summer. So we try and have as much fun as possible. We're not all rigor. I promise we're fun too. So for your fall or spring start of your upper division, this is what it's going to look like. The first semester of your junior year in either fall or spring, you will start off with a boot camp in the Resource and Simulation Center with Susan Edwards. She will run you through how to put on your scrubs, how to properly wash your hands, how to move a patient from a bed to a chair, all of these basic skills that you will need to know before you go and you deal with patients one-on-one. Then you will have a geriatrics. Well, actually, you have a pediatrics rotation. Your pediatrics rotation is actually going out to the Catholic schools here in Spokane and doing vision and hearing screening with the little kids. This is getting you used to dealing with pediatric patients, how they're going to ask you questions, how to talk to them, how to chart. All of these items you will learn during this. You will also have a geriatrics rotation during this semester where you will go out to a senior living center and actually use these skills that you learned in the Resource and Simulation Center, basic daily living skills, where you will learn how to help the patient brush their hair, their teeth, bed baths, how to change them, how to clean them, all of these items so that you know how to handle patients, how to be the nurse, and how to do all of these things. Parents, don't freak out. We're not having our students do this by themselves. They always have a faculty member with them while they are doing this, either a faculty member that we have that teaches or a faculty member that we have trained and works for our program. At the bottom, you can see nurse tech opportunity here in Washington. After you've completed your first semester of upper division coursework, you are now properly trained to become a nurse tech. The difference between a nurse tech and a CNA is that you can actually perform medical procedures to the level of your education. So after your first semester here, like I said, with the geriatrics and peds, you might be able to administer shots, transfer patients, do bed baths, all of those pieces. And then after your second semester, even more skills administering medications, putting in a catheter, all of these things. So nurse tech opportunity is rather large for our students. They're very interested in it. They work with your schooling. They make sure that they don't overlap and their requirements are not very high. At the end, if you have more questions surrounding nurse tech, Ellie actually got the opportunity to be one over the summer, so you can ask her a little bit about it. In your second semester of your junior year, you will now start going out into the hospitals. We start you out with smaller hospitals. So we start out with a medical surgical rotation where you will be out in Spokane Valley. During this rotation, you are definitely going to be seeing surgeries. You'll be in the emergency department. You'll go and see some of the outpatient procedures, possibly like endoscopies, those kinds of things. That's what you'll see during this rotation. You're going to be following something called a traditional model where you follow the nurse that is on staff during your rotation for that week, but it might be a different nurse the following week. We changed that a little bit in the following semester, and I'll talk about that in the next slide. But during this semester, it's kind of getting you used to being in a hospital setting, but a smaller hospital setting. You also get to do a women's health rotation and newborn rotation during this. This is where you're going to see live births. You'll see C-sections, vaginal births. You'll go into NICU, potentially postnatal, prenatal, all of these pieces of the women's health and newborn rotations. You also will have a community mental health rotation during this semester where you will have the opportunity to see the outpatient psych. You'll get to deal with patients that have mental health crises and be able to figure out how to handle the psychiatric piece of being a nurse. You also will have more to do in the Resource and Simulation Center. Susan Edwards always believes that you should try and see this on a mannequin before you see this in person and live on a patient so that you know how to handle this situation. That being said, During this semester, we start to introduce you a little bit more to how it will feel in the hospital settings. We will hire actors from the theater program here on campus that will come in and act as parents of the babies. We actually will have quite a few things to make it very realistic. Kara Smith makes certain that the urine, the mucus, poop, pee, all of those things, they look exactly how they're supposed to look, as they will when you're out in clinical rotations. Now, like I said, this traditional model on the bottom is how your first and second semester will go. You'll have a clinical instructor that is trained and paid by us, that is assigned to 10 students. Those 10 students will be out on the floor and dispersed among nurses that are taking on different patients during that time. Once you enter in your third semester, which is on my next slide of upper division in your senior year, you'll have actually something called a DEU model during your medical surgical rotation. You'll be assigned to one nurse and you will follow that nurse with that nurse's schedule, and that nurse will get to know you through the weeks of your rotation. It's better for the students during this DEU model. It deepens their learning experience, and the nurse gets to know them, so they know that they can give a catheter. They know they can give a certain med. They know they can transfer the patient. So it's less hands-on from this nurse that is teaching you and watching over you. The students really enjoy this piece so that they can learn more on how to do it while they still have somebody standing there and watching over them. Your third semester, which is in your senior year, you will have another medical surgical rotation. However, this is at our bigger hospital here in Spokane at Providence. You'll have your more sick patients. You'll go into, not peds, but you'll go into oncology. You'll see the more severe inpatient procedures, emergency departments, all of these pieces during this rotation. You also have a pediatric rotation. This is when you're going to see the kids that are inpatients, peds surgery, peds oncology, a lot of different pieces where you'll get to be more hands-on with the patients and learn how to deal with this. Parents, if I remember correctly, one of the questions that you guys have often is, do my students need a car? When it comes to the acute psychiatric mental health rotation, some of our students are going to be assigned to Eastern State Hospital. That is in Medical Lake, and it is about 25 minutes outside of Spokane. Students will need a car to get there. We do not give them transportation. However, all the rest of the rotations I've talked about are on a bus route, so they can get there on the bus, which their ZAD card will get them there. When it comes to Medical Lake, there is no bus that takes them there. So they will either need to carpool or have their own car to take them to the acute psychiatric mental health. Also, side note for clinical rotations, you are training to be a nurse. So that means it is very rare that clinicals will be canceled for snow. If you are not used to driving in snow, you will have to get used to driving in snow. It is very rare that we will cancel due to snow. We're Spokane, we get that a lot. So just keep that in mind as we go through all of this. Resource and Simulation Center in your third semester is a little bit more intensive. This is when you're going to start going down into the simulation suite, which is set up like hospital rooms, and you'll actually start getting tested on your clinical skills. So you'll go in there. This is where we use actors more robustly. You'll go in and you'll have to deal with the patient with 2 other students. Then three students are going to be watching you from another room, and you'll switch off after 15 minutes and then debrief. When you guys are all done, you'll talk about what went right, what went wrong. I've heard a lot of students really enjoy this experience. It really makes them feel secure and ready to go out into the hospitals. And it makes them feel like if they make a mistake, they know they won't be making that mistake again. In your fourth and final semester in the program, you start off with your senior practicum. All those experiences, you may have had one where you only had it for 2 weeks, maybe in the NICU, maybe in the PICU, and you want to go back there. So like Ellie right now, they will apply for a spot in practicum that they want to go back for the first 5 weeks of their last semester to take part in. They do not have classes that they take during these 5 weeks. They follow one nurse, they have their scrubs on, and they are a nurse for the first 5 weeks of this semester. There's a side note on this one. We do have some spots in Seattle. We have some students that are from Seattle. There is Seattle Children's. We have about 5 spots over there. We do pay for a faculty to be over there to teach you. We do not pay for housing or transportation or food. So if you do want to do the Seattle Children's spot as your senior practicum, usually our students will do an Airbnb, stay with family, one of those things, and then have to pay to get over there. Once you come back, you have 5 classes that will prepare you for the NCLEX, interviews, all of the things that you need to know and get ready for as you leave our hallowed halls. And you will also complete a community health rotation where you get to do a project for the community to better Spokane community. We've had students do some really fantastic pieces that I've heard praise from the entire community from. Joya just came to our sophomore class and told us that one of our seniors actually created a program for them that they have kept now for 3 years. That is like a group for a bunch of parents that have children on the spectrum so that they can talk to each other once a week and feel support. So our students do some really fantastic things. Resource and Simulation Center really gets them ready during this semester. They do the same tests that they did as their first semester senior year, but alone. So they will go into the room and they will do a solo running the room with their patient while being tested on it. Students do very well on this. We make certain that they are prepared for every step. We also have an awesome disaster sim that we have created in the last semester that my son and I participated in last semester to get our students ready for anything that they may have to encounter in the future and see if they're really interested in being, you know, one of those nurses that's going to go out there after a disaster. Where are our graduates employed? Everywhere. They go wherever they want to go. We have a big chunk of you that want to go to Massachusetts for some reason after you leave our program. But we also have a lot of students go back to California. We have a lot of students stay here in Spokane, but to be in any department that they want. The RN residency programs are becoming a lot more robust as of recent. So a lot of hospitals will have that so that you're a new grad for about a year, you get trained in your specialty, and then you get released to general nursing of your choice. We also have ROTC students that go into the armed forces after they are done. And we have some students that go into the Jesuit Refugee Service or the Jesuit Volunteer Corps, which pay back a certain amount of your tuition. And that is the end of my presentation. So now we can open it up to questions.
Awesome. Thank you, Alex. There are just a couple questions that we got in the Q&A at this point that we are hoping to answer out loud. Some may have been touched on along the way, but just want to make sure folks get their questions answered. You talked about honors a little bit already and kind of the credit load and the need to communicate. Can you talk about kind of maybe how frequently you see students doing honors, what the time looks like, course load, that kind of thing?
Yeah. So to be honest, so everybody is completely aware, I have quite a few freshmen that'll come in as honors freshmen. However, once they progress through and get into upper division, it becomes very difficult for you to take coursework while doing clinical rotations. So because honors is also a very rigorous path, and you have to take courses typically all through your time here at Gonzaga, it is really difficult to get coursework completed. Nursing doesn't overlap with honors. We have about one honors course in upper division and one GU core course that's honors. So it becomes very difficult. It's not impossible. Like I said, with the minor requirement, it just takes a lot of communication with me as your advisor and the honors advisors to make certain that you're fulfilling all the requirements you need in the time frame that you need to complete them. So it's doable. It's just a difficult path.
Alex, we had another question, and you may have addressed this a little bit, but what are the steps to becoming a specialized nurse, like a pediatric nurse?
So in our program, like I said, we're going to get you into a nurse generalist. That's what you're going to graduate from our program with. You are going to be poised to go into whichever specialty you want. It's really which jobs that you apply for. That being said, from what I've heard, most of the time you need to go through a couple of groundwork years where you're doing some general nursing to get into specialties, but it's applying to the jobs themselves. So you need the BSN to get there, but you're poised to get into whatever specialty you want. So if you want to be a peds nurse, you'll apply to a peds position and see if you can get in. If not, then you just reapply and go through the process.
Alex, I know we chatted a little bit earlier. Do you have any insights about the nursing, living, and learning community, or would you recommend folks lean towards asking housing about that?
I would lean towards housing, asking about that. It is rather new. So I do have some students that are in it. I know that there's certain coursework that you'll need to take as a freshman so that you're sticking with your living learning community. However, I don't really have a whole lot of insight into it because it is so new.
I'll throw a link in the chat for folks to explore a little bit more. That'll also include a little bit of contact info.
Alex, this next question is, do you know what proportion of our BSN grads go on to graduate nursing programs, ARNP or other?
Actually, I don't know that off the top of my head. I know I have a small section of students that want to go into grad programs, which we have a lot of grad programs. From my understanding, a lot of students, at least this year, have been asking me about the nurse anesthesia program, which we do have that. It's very competitive, but we do have that as a nurse anesthesia program. Ellie, do you have any insight onto how many students that you know that go into further education?
So generally speaking, once you graduate with your BSN, you're going to want to get at least 2 years of experience before going on to get a graduate degree in nursing, especially if it's an advanced practice nurse. They're going to want to see that you have experience. Now, I know of a few people that have worked as a nurse for about a year and have lucked out and gotten into programs, but generally speaking, for an advanced practice nurse, they want you to have a few years of experience. So, I mean, I have friends that are probably headed towards that direction eventually, but you got to get kind of your feet on the wet first before taking that path as well.
Well stated, Ellie.
We have a question here about internship opportunities. Do we post these, any internship opportunities for nursing students to apply to?
I mean, we always, whatever we hear, we always post those to our students. We get a lot of different opportunities that are asked of us, or scholarships, those kinds of things. Whenever we get them, we post them to our students. So we're always posting things. But we're always open and telling our students about what we know. We never keep it to ourselves.
And then we just had a clarification question around majors and minors. It is possible to minor just as long as the minor coursework is done before clinicals. Is that correct?
Yes, it is possible to do a minor for sure. I know I have a lot of students that are either running START or have an AA. That alleviates quite a bit of your lower division coursework because it takes some of your freshman core or possibly your core broadening classes off of your plate. So it does give you some room to add in minor coursework. So it is doable for sure. You just have to get it done before you get into upper division. Yes. Or do it over the summer.
So we have a question here from student. I am working part-time as a CNA in an assisted living facility while I finish high school. Does this experience help in the admissions decision?
Ooh, I'm gonna let you guys answer that because
Yeah, you're good, Alex. I can jump in on this one. We love to see students that have had the opportunity to get healthcare experience, whether that's working as a CNA or volunteering in a hospital or working in a retirement community or really anything that is within healthcare or kind of adjacent to healthcare. We absolutely encourage you to list that on your application, talk about that in your activities list. And in the nursing supplemental question, it'll ask, the question is, why are you interested in being a nurse? And if you can draw on experience that you have, we love to see that. We also know that not everyone has the opportunity to get that type of experience. And so we really do look at that nursing supplemental question of why you want to be a nurse. We look at your academic preparation, all of those things like Levi and Will talked about with that holistic review. But if you have had the opportunity to get that experience, please do make sure to include that on your application, because we do want to know if you've been able to do that.
So we have a question here asking basically if a student's still kind of trying to decide whether or not to take on a minor, can they meet with you about whether it is doable, just given that a freshman already has a lot on their plate. I'm not sure if the you is addressing us on the Office of Admissions or you, Alex. Of course, you can always reach out to your admission counselor, but Alex, if you'd like to respond as well.
There's an interest survey that gets sent out and asks students their interests in minors, those pieces. So students get these added on. It's not a difficult path to drop your minor. So I always tell students to add on what they want to add on at the beginning. Let's map it out together, see what it looks like, see if you feel overwhelmed when we map this out together. And if you start feeling overwhelmed just through our mapping process, then maybe we might need to discuss not taking on that minor. Just a side note, because minor is such a big topic on this, and you guys have asked a couple of questions, it is part of my duty to make sure that I'm covering these topics. I did a lot of research over this past summer with grad programs and just through general nursing hiring. It does not make you more employable to graduate with a BSN and be honors. It doesn't make you more employable to graduate with a BSN with a minor. The only thing that is going to be beneficial to you in the hospital setting is knowing another language. That is going to make it definitely more beneficial for you while you are out there, because there are a lot of populations that don't speak English. So if you want to learn another language, that is beneficial. However, all of these other pieces will not, it's a very experiential degree. It's something that you need to learn, you need to be hands-on with, and having a minor in psychology or having a minor in any of these other pieces, while theoretically it gives you some pieces, our program is very rigorous. Gonzaga's program is very well-rounded, and paired together, you become a very well-rounded person. And you get just overwhelmed in upper division when you have too much on your plate.
We do have one more question about minors. Just so I'm curious, and Ellie, you might have a strong answer to this since you're around so many of your cohort. What is the most common minor that nursing students do pursue?
Ellie, I'll let you go first because I think I know.
So to be honest, I don't know. I probably know 2 or 3 people in our cohort that are minoring in something, but that's just based on my experience. I want to say psychology though. I feel like it's usually psychology, but I know we just added a health equity minor, and that public health thing is new. And so I would suspect that that minor would probably kind of increase in the near future as well.
So it's a mixture. Psychology is pretty prominent. There's also a health equity minor here on campus, which is a sociology minor. And then we have quite a few students that are really interested in the theater. So they're like minoring as a sophomore and a freshman in music or dance or something like that. That being said, again, my students typically have these minors as freshmen and sophomores, and then they drop off. So my graduating seniors for this year, I just audited them, and I have 4 that will be graduating this year with minors or honors.
Awesome. Thanks, Alex. Just for the sake of time, we've got a couple more questions to answer live. I think one of them is a really great way to wrap up. So this first one, if you could, Alex, do you have a sense of what the gender breakdown within the nursing program is?
I love this question. So previously, it was, I think, typically 3 to 4 guys every cohort. That means when I had a cohort come in of 88, I had 3 to 4 gentlemen also in that cohort. However, very excitingly, in my class of 103, I have 10 gentlemen that came in this time. So about 10%, and I'm hoping that we increase that because we are starting to be so open and honest about how much we really want diversity to increase in our department and in our student population. So 10% now, but I'm hoping it increases.
Awesome. Thank you. And then this last one, I think, is a really great way to close us out. This question is, does the Gonzaga nursing program tend to be manageable for nursing students in terms of morale and performance of those within the program?
That is a very big question. Morale is a very big piece just for nurses in general. We support our students holistically. When I say that, it's not smoke, it's what we do. So for instance, right now, we just had a very difficult exam for our senior ones. The person who teaches the senior ones for that exam is across the hall from me. She has had students in her office every single day since that exam has closed, because she wants to make certain that everybody feels heard, that everybody has the answers that they need, and that they have the support that's necessary. They also have academic advisor. I'm staying with all freshmen and sophomores, and then they transition onto a faculty advisor as a junior or senior. So every student has a nursing faculty advisor from day one that stays with them throughout the entire program to make sure that they have all resources that they need. We also have an amazing team in Cura Personalis here on campus that helps our students if they are starting to struggle in any areas that I can pull in to help us support the students. We want to make sure everybody is really ready to go through and get this degree. And really, honestly, if you see any drop off in our numbers, it's mostly students that have decided nursing isn't for them and they've decided to change their major to something else.
All right, everyone. It's been a pleasure being with you this evening, and we highly appreciate your time. Please join us again for our in-person Nursing Fridays on October 25th and November 1st, if you are able to. We also have several in-person and virtual information sessions, interviews, and daily campus visits. You can sign up for those by visiting our virtual and visit in-person Gonzaga websites. We wish you the very best with your college process and hope you let us know when and where we can help. Thanks again for attending and for your interest in being a Zag. Have a good night, everyone.